looking into the facial bones of the skull. Now, these are the bones that are not touching the actual brain. First off, we have the nasal bones. If we tilt this back, you can see there are two nasal bones right here. They make up the top bridge of the nose, because most of the nose would be missing here as cartilage. We then have the maxillary bones. I'm going to zoom in a little bit to get a better view. The maxillary bones are found here and here. They're what are making up your upper jaw, basically. The maxillary bones will have the alveolar process, also known as the alveolar margin. That's what's coming right along here. Think of it as your gums, where your teeth are. This portion right where the teeth are inserting is going to be the alveolar process. You might hear it as the alveolar process of the maxilla, but alveolar process is fine. Now, to see the palatine process, I need to change the view here. Now that we've reset, you'll notice the mandible has been dislocated. That's the lower jaw. You're seeing the teeth. These are the teeth of the upper jaw that go in the maxillae. We're looking for the palatine process here. Now, the palatine process is the anterior portion. So up here, because this is the anterior side, this is more posterior, anterior side of the roof of the mouth. The posterior side was behind this line, so this is posterior. This will be the palatine bone. We'll come back to that a little bit later. So this is the palatine process, each side here, of the roof of the mouth. It's what's anterior to this line, because that separates the next bone. So it's the palatine process. Now we need to move on to the next landmark, which will cause an orientation shift with a change how we're looking at the skull. Now that we're back to the anterior view again, we can look inside the eye orbits. Remember we mentioned before, there was this top slit. That was the superior orbital fissure of the sphenoid bone. Now we're looking at this lower slit. That lower slit is the inferior orbital fissure. So again, we're in the eye orbit, but it's the inferior orbital fissure. So there's two slits. Top is superior, bottom is inferior. And we're focusing on this lower inferior one, inferior orbital fissure. After that, we have the infraorbital foramen. Now the infraorbital foramen is this hole right here and that hole right there. Infra, below, orbital, eye, so below the eyes are the infraorbital foramen. And then we have the incisive foramen. The incisive foramen, I need to reorientate the skull again. Now for the incisive foramen, we're back in the same view we had before for the palatine process. So this is the top or the roof of your mouth. These teeth are your top teeth. What we're looking at though is this little indent right there. That is the incisive foramen. So it's right in the middle, behind your incisors, incisive foramen. So that is all parts of the maxillary bones. We then come up to the zygomatic bones. Let's reset the jaw and put things back in place. All right, orientation-wise here, you can see that we're on the lateral side of the skull, anterior, posterior. This bone right here, basically it's your cheekbone in essence, but that's called the zygomatic bone. You can see this line right here is where it's the anterior border. You can see this line right here is a posterior border. So it's only this portion right here, that's it, zygomatic bone. The zygomatic bone is going to have the temporal process. Right here, this little area is the temporal process, is what leads into the temporal bone. If you remember from a previous video, we talked about the zygomatic arch is this whole thing. This portion of the temporal bone was the zygomatic process. Well, this portion of the zygomatic bone is going to be the temporal process. Temporal process because it leads into the temporal bone. So the whole thing is zygomatic arch, but the part that's up here on the zygomatic bone is the temporal process. Next bone up is the lacrimal bone. Now the lacrimal bone itself, you can actually see in the eye orbit. It's this portion right here. So that is the lacrimal bone. It's just anterior to this part, which is part of the ethmoid, and then just posterior to this, which is part of the maxillary bone. And that's the nasal bone way up front. But that is the lacrimal bone. Now the lacrimal bone is going to have the lacrimal foramen. Again, these plastic skulls don't always have all the foramen punched through. So this little indent right here, that is going to be the lacrimal foramen. Now that we've reset this skull, we can notice looking on an inferior view, looking at the roof of the mouth here. The mandible has been dislocated and moved out of the way. We're focusing on the roof of the mouth here. This is the anterior portion up front. This goes towards the posterior portion back here. If you remember, this anterior portion of the roof of the mouth, that was the palatine process. We're trying to focus back here on the posterior portion of the roof of the mouth. So everything behind or posterior to that line, because that line tells you it's two different bones. This is the palatine bone back here. So the palatine bone. Now on that palatine bone is going to be a landmark called the horizontal plate. This flat portion, which makes up part of the roof of your mouth, that is the horizontal plate. So you have to be careful. If there's a tag or something saying, what is this? You have to read, is it the bone or is it a landmark? ID the bone, that's the palatine bone. But ID the landmark, that is the horizontal plate here. So looking at two different things in the same spot. The bone is the palatine bone. The flat portion here, that's the roof of the mouth, is the horizontal plate. So that is your palatine bone. Now we need to reset this and put the mandible back in place and get a different view. All right, now we're seeing the mandible from a lateral view. To orientate, this is the anterior side, this is more posterior back here. The mandible is this whole bone, goes all the way around and comes back up the other side. This is your jaw. Really, it better be the only movable bone in your skull, to be honest. Nothing else should be moving except for this mandible. All right, for landmarks, we're going to have to turn this a little bit. The body of the mandible, this whole chunk right here is the body of the mandible. So the whole bottom portion is called the body of the mandible. Now we're going to have mental foramen sitting right here and right here. So right in the body are two holes. They're called the mental foramen. Now going back to the lateral view, you're going to notice that on this lateral view, you can see the angle of the mandible. This is the angle of the mandible. So the angle of the mandible. Then you have the ramus of the mandible. That's this portion going up. So this whole thing here is the ramus of the mandible. We're then going to have the mandibular notch. This indent is the mandibular notch. Mandibular notch. We then have two processes. We have the condylar process and the coronoid process. Let's start with the coronoid process. If I angle this just a little bit more, this whole piece right here is the coronoid process. Be careful of that spelling, coronoid with an N, because that one letter, that N, makes a difference. There is another landmark later on that the N changes something else. But for now, coronoid process. This one back here that's sitting in this joint, So if I just take it and dislocate a little bit, this dislocated portion you see right here, that is going to be the condylar process, or known as the mandibular condyle. So the one that's more posterior is the mandibular condyle, or the condylar process. The one that's more anterior over here, that is the coronoid process. All right, let me put this thing back together so we don't have a dislocated jaw. All right, with the jaw back together, you can see again, condylar process or mandibular condyle is up in there. Coronoid process. Here is your mandibular notch. Ramus comes down into the angle, leading into the body. You can notice there's a mental foramen right there also. The alveolar process, or alveolar margin, is where the teeth are. So that's basically your gums. This is where the teeth are. And yes, this is the same term as was found up here on the maxillae. They're both alveolar margins. Alveolar margin of the mandible is down here. Alveolar margin of the maxillae is up here. But they're both alveolar margins or alveolar processes. And then we have the mandibular foramen. Going to have to reset this one so we can see that. All right, having dislocated the jaw, you can see this is the posterior side down here. This is the mandible. So the teeth are up here. We have the two condyles up top. But inside right here, there's this little indent. That is the mandibular foramen. So it's on the inside of the actual ramus, the mandibular foramen. All right, next bone is the vomer, but let's reset things. We're back to the anterior view of the skull. This, again, remember, is the nasal septum. The top portion is the perpendicular plate of the ethmoid. We're looking at this inferior portion down here. The lower half of the actual nasal septum is the vomer bone. So the lower half of this nasal septum is the vomer bone. So that is what we're looking at for the skull. Now, sometimes there are extra bones, though, called Wormian or sutural bones. So now that we're looking in the sutures, you can see there's this one little piece right here. See how it's completely outlined? That is a Wormian bone or a sutural bone. It's an extra bone that grows in where the suture is. Some people have them, some people don't. Sometimes they're very large, sometimes they're very small, like this one. But a Wormian bone or sutural bone is going to be a bone that grows, an extra bone inside the suture. So those are the facial bones.